Welcome back. 2 billion people in the world lack access to basic surgical care, and every 3 minutes a child is born with a cleft lip or palate. Operation Smile will tomorrow depart to Malawi for a surgical mission. It follows their successful mega mission trip to the Democratic Republic of Congo, where they performed 250 corrective surgeries on affected children. Tamlin Abrahams is the Operation Smile Regional Director in Central, Southern and West Africa. She joins us now from our Cape Town studios. Tamlin, thank you so much for joining us. Now, every 3 minutes a child is born with a cleft palate. That's quite scary. How many of these children get treatment?
Hi, evening, Lulu. Thank you so much for having us here. And you know, for me, when I first joined Operation Smile, I was also shocked when I heard those numbers. And the reality is that in each country it varies the number of surgeries that are able to be provided. It's estimated about 1 in 1,000 children within Africa are born with this facial deformity. And so it really, for us, when we go and do these surgical missions, we find not just 10, 20 patients who come, but hundreds. So the need is really enormous, but about 1 in 1,000 in Africa are born with this condition.
Now, Tamlin, can you just briefly tell us about the surgical missions that you have been doing?
So Operation Smile is a global non-profit organization, and we really rely hugely on volunteers to make these missions happen. All of our work that we do in any country is under the umbrella of that Ministry of Health. We have a signed memorandum of understanding with them, and we work hand in hand to support them with their national cleft care strategies. And in each country it depends, but our surgical missions are normally about 10 days long. And we have volunteers from over 60 countries around the world that will come on a mission. It's about 80 volunteers for 10 days, in which we'll screen over 300 patients in some countries, and then be able to provide surgery to about 150 children and adults. So our volunteers are both medical and non-medical volunteers, and the South Africa Foundation has a huge number of volunteers that support the work both in Africa and in some of the other countries around the world.
Now, Tamlin, just speak to us about the aftercare of the surgeries. Once you and your team have left that country, what happens thereafter? Who takes care of the children and makes sure that everything is in place?
So Operation Smile has a headquarters in the US. We're in over 60 countries, and so, as I mentioned, you know, here in South Africa, we've got a foundation, and our volunteers are there to support the patients post-surgery. So local volunteers here within the country who work year-round, and so in each of the countries we work towards those programs being self-sustainable models, in which when we go and work, we will do training programs and then support those partners there to be able to take care of the patients throughout the year. So we do have local teams in each country, and then we also have a small team that we'll send every 6 months to do a road show that we go closer to the patients to follow up with them and bring additional services that might not be available in the country, such as speech therapy, which is really vital, especially for patients who have cleft palates who'd been repaired, so they need a lot of support in learning how to use those speech muscles, and then also dental follow-up. So we are committed for the long term. The first surgery is really just the initial step, because it really is a long road to become part of not just society in being able to smile, but being able to also have a family and be really part of the community that for so long they did not have the opportunity to engage with. So yes, we do have follow-up programs, but then also local teams that are there to support the patients in between those 6-month assessments.
Now, Tamlin, what are the causes of cleft lip or cleft palate?
Globally, there is not really been programs that have been able to pinpoint the exact reason for it. There are three main common factors that are looked at, which is poor nutrition and lack of folic acids and B vitamins in the first 3 months of pregnancy. It is also, in some instances, it seems to be a genetic factor where you will find it in the family that it runs through, and also possibly environmental factors. Operation Smile is also investing in research programs where we're doing genetic research to try and see what could possibly be the causes for it. And it's a collaboration across the world with various hospitals and partners, and then university hospitals in the US that will then look at that research. So for us, it's something we're investing into, but unfortunately not something that has been able to be said that specifically, definitely we know is the cause. And the statistic varies from Asia to Africa to Latin America. So it is also, there's variables to look at in that.
Now, Tamlin, cultural beliefs about cleft lip or palate can harm patients even after surgical repair. Now, what mechanisms do you have in place to deal with this?
So Operation Smile, as I mentioned, when we do our post-op follow-up with patients in the communities, we go closer to their homes. So for example, here in South Africa, our team recently conducted provincial road shows where we traveled through 6 of the provinces, and we meet with community birth attendants, with midwives, community healthcare workers, dental technicians, and go to the primary care clinics all the way grassroots levels to churches, work through other NGOs, and try to also work through a variety of means to share information about clefts. And we've got presentations that we go and do in specific town settings where we get community workshops together, and really try to go also into schools, both in high schools, primary schools and universities, and talk about it. And I think that's the big thing, is asking people to talk about it, to share the information, and using previously operated patients as our really big ambassadors to also share their success stories, and to be able to show that. So, you know, there are a lot of patients that unfortunately in some of the really rural areas do unfortunately get killed at birth. We hear some of these very sad stories, or don't make it to their first birthday due to some complications with feeding. So for us, it's really important to be able to go and work in the communities, grassroots levels, as well as with the government ministries of health and schools as well.
Tamlin, how do people get a hold of you?
We do have a toll-free number, 08000-SMILE, and so that is a great way to contact if you do know of anyone in the community in need of surgical care or follow-up or any assistance. We work here in South Africa with the existing cleft centres as well as other organisations to get care as soon as possible for patients. We also have a surgical mission that is coming up in September, so we really encourage, please do phone if you know of anyone. And then we also have an office number, which is Cape Town 021 447 3608.
Tamlin, thank you so much for joining us. That was Tamlin Abrahams, the Operation Smile Regional Director in Central, Southern and West Africa. And she was speaking to us about Operation Smile's surgical mission in Africa.